Clinical hypnosis can sound like an intense and perhaps scary treatment, but they do have a place in helping some people. To help us better understand how it works and who it can help, we are joined by clinical psychologist Lisa Rowbottom. Now, Lisa, how does clinical hypnosis work?
So clinical hypnosis will move you into a calmer state. It's a state we refer to as a trance, but basically it shifts your brain waves into a space in between alert and awake. And when we're in that space, we have less thoughts happening in our brain. We're not as defended around certain things we may want to work with. We're a little bit more suggestible, but not a lot. So I can't, if I have induced a trance, I can't tell you to cluck like a chicken in my office or every time the phone rings. It doesn't work quite like that. But it's a really relaxing experience, and it's a really good way to work with shifting some of those things that maybe are hard to talk about.
Can you explain exactly what a trance is?
So a trance is a highly relaxed state, but the reason a lot of people are worried is they often think, well, if they go into a trance, they're going to be completely out of control. And that's not true. There's always an aspect of your brain that is a bit of a governor. It's always aware of what's going on around you. So even if you are in a trance state, I'm never going to be able to tell you, I want you to do something you normally wouldn't do. Because that governor part of your brain is going to go, no, we don't do that. But it's a really highly relaxed state, and when you come out of it, you feel quite refreshed. You feel a lot better.
Who is this therapy really help out?
It helps out people who are often they have a bit more of a challenge, maybe expressing some of the things that have happened to them. There is such a thing as hypnotic suggestion, but like I said, it's not as potent as maybe we would like to believe from popular portrayals. But if you're someone who's struggling with, say, anger, or wanting to maybe shift a few things around your New Year's resolutions, that maybe you want to stop a few behaviors, then it's definitely something to explore.
Who is it not for?
If you are someone who has difficulty relaxing, or difficulty kind of letting go of that control, then you're not going to be able to slide into that trance-like state, and you're really going to struggle with it. You could get there, it's just a little more difficult. Or if you're someone who wants really active, now, what can I do kind of therapies, this isn't going to be for you.
How long does this trance usually last? Is it 1 minute, 5 minutes?
It really depends on what we're doing. So for some people, the trance will last a good portion of the session. If we're doing some, deep work that we're sort of pulling things up that maybe are normally avoided. But I could use it, let's say, to implant, implant sounds pretty nasty, but to include a post-hypnotic suggestion, and I could do that in, 5 minutes, 10 minutes, if you're someone who can be moved into a trance relatively quickly.
Well, thank you so much for joining us this morning. For more information on Lisa and her clinic, you can go to Sojourn Psychology's website at sojo.ca.